Hello and welcome. This video will cover all of the information for this topic. Feel free to watch the full video, or if you prefer, you can scrub along the timeline at the bottom and jump straight to the section of your choice. Ensuring clients perform exercises with correct technique and optimal postural alignment will avoid injuries and promote optimal musculoskeletal function. Optimal postural alignment can be promoted by educating clients on the importance of good technique and alignment at all times. By demonstrating a correct deadlift, which is the foundation of a safe lifting technique, will greatly reduce any possible injuries when lifting and carrying weights. Regular promotion of optimal postural alignment during all exercises is good practice, while also ensuring alignment and technique is never compromised over intensity. It may be appropriate to reinforce technique via cues or demonstrations by taking videos or photos showing your clients of their current technique and where it may be improved. Ensuring clients learn and execute exercises correctly may require the development of new movements, which may need to be communicated appropriately to the client. There are many different ways to communicate a new skill to a client, often with multiple techniques being used during the session to maximise learning development, as each individual will have a different learning style. These techniques may include a verbal and auditory approach, which may include simple cues, auditory instructions, or corrections to the client. A visual approach, which may include client viewing demonstrations from multiple angles, or watching a video or viewing photographs of a technique being performed. A kinaesthetic approach, which may include supervising the client repeatedly performing the movement, making any alterations if needed. A cognitive approach may be used, which may include the adaptation of a previously learned movement or the breakdown of a complex movement into smaller, less complex elements. And finally, you may use a proprioceptive approach, which may include tapping the client on a muscle or specific area to focus that area for activation. This is particularly effective for clients who are already familiar with techniques and may alter their technique during fatigue, where optimal alignment may be compensated for. However, if using a proprioceptive technique, always request and receive permission before going hands-on with the client. Ensuring that clients receive appropriate positive reinforcement of corrective exercise performance will promote client self-efficacy. Positive reinforcement can be given to clients through verbal praise and encouragement when appropriate to do so during the session, with some clients being receptive to physical connection, such as a high five or a fist bump, to celebrate and recognise their achievement. However, wins are acknowledged, ensuring that praise is not given without warrant and not too often, as if used too much will become familiar and may not have an appropriate effect. Positive reinforcement is also good to demonstrate to a client the progresses which they may have made, particularly if they feel that they are plateauing or are low in self-confidence. This can be achieved by demonstrating a client's progress, maybe through a training log, videos and/or photos of their progress to date. It may also be appropriate to praise a client to others or use them as a positive example to promote client self-efficacy and their confidence. Ensuring to observe client movements accurately will enable trainers to identify valid and appropriate strategies to improve their client's exercise technique. When observing clients during a session, you should remain professional and focused and aware of the client and their possible limitations. Always move around the client to observe from different angles. This will give you a greater understanding of the client's movement pattern and any possible movement dysfunctions that they may present. When monitoring clients, ensure to maintain an appropriate space and positioning which is not intimidating by being on the same level as the client and not domineering them. Avoid prolonged eye contact or talking to the client during exercise performance, as this may be distracting. And also avoid touching the client unless appropriate to do so, and you have received the relevant permission. By implementing appropriate modifications for a client when necessary, will ensure both their safe and effective training execution throughout the session. A modification of an exercise may be required when a client is injured and cannot perform at safe execution. A client may be fatigued and safety may be also compromised. It may be the case that the complexity of the exercise may or may not be too challenging for the client, or that the intensity may be too high or too low. There may also be situations during busy times where required equipment is not available and adaptations to the programming or modifications to the planned exercise may have to be made. You have now completed all of the content from this topic. If you have any questions from what was covered, please contact your tutor. Or if you'd wish to test your knowledge, why not try some of the mock questions? If you're happy with your progress in learning, feel free to move on to the next topic.